Hi, my name is Melanie Wright. I'm a senior health studies major, and I want to be an occupational therapist in the future. So I chose late adulthood as my category for this project. Late adulthood is something I'm definitely going to deal with in my field, although I do want to focus on pediatrics. I'm never going to know where life's going to take me, and I'm not opposed to geriatrics at all. And this is my project. So, just to introduce myself and give some background, I included some photos that I feel best represent my life in the most general sense. So, here on the left, you see a screenshot of my Instagram. This is actually my art account, and I really do love art. So, I think that's also great um, for occupational therapy because a lot of it is creative when you're working with patients to achieve different goals. So, it's nice to know that at least I have that ability with me. But I really do love art, and it's important to me, and it's a big part of my life. So this photo that I have attached is a picture of my mom and my younger brother John. John's the huge reason behind why I want to be an occupational therapist because he's autistic and epileptic and has been for a majority of his life. And I feel that I need to give back to that community, and the best way to do so would be occupational therapy in my regard because I really want to be hands on and develop that personal relationship with each client and help them improve their lives as best I can. And also, additionally, I'd like to apply the knowledge that I will gain from graduate school to my own brother to help him with his life more as much as I can. He's a huge inspiration to me and the reason behind why I do a lot of what I do, and I'm very grateful and lucky to have him in my life. So this photo of the pool is my job. I've been working at Silton Swim School in Manasquan, New Jersey for the past 8 years as a swim teacher. I love it. I've also had exposure to a lot of kids with disabilities, and whether that be physical or cognitive. So it's offered me great experience, and it's an awesome job to have. I also work as a lifeguard during the winter mostly at the Atlantic Club in Manasquan, New Jersey. I love to swim, as you can see, and it's really quite simple. And I've met a lot of great people there. I've been working there for about 2 years, but going there for the majority of my life. And it's a great job to have, very relaxed, and it's nice talking to all the members. This is my other job called Pete Nelda's. Well, that's the bar. The restaurant is Carmen's, although it's the same place. It can get confusing sometimes, so I just wanted to clarify that. I just included this screenshot from a video of a Barstool Pizza review with Dave Portnoy, who is actually really famous on social media for his one bite pizza reviews. He came to my job once. Unfortunately, I hadn't worked there yet, but that's my other job. I food run and I work in the back doing takeout and I hostess, and I'm eventually going to be a server once school calms down because it's just too much right now. The All Care Therapy Services LLC picture is an occupational, speech, physical, and ABA therapy centered private practice in Howell, New Jersey. That's where my most recent internship is, where I'm observing an occupational therapist that I actually met at my swim school job. Um, I've been working there since the beginning of September and will be throughout the year, and I've learned a lot already, and I'm excited for what's to come. So just to introduce myself and give some background, so this photo that I've attached, so this photo of the pool is my job. So cognitively, the brain shrinks and slows, but still has plasticity in late adulthood. Additionally, 5% of the brain's weight between ages 20 to 90 is lost. The brain also loses some of its volume due to the shrinking of neurons, lower number of synapses, reduced length and complexity of axons, as well as reduced branching of dendrites. The prefrontal cortex is usually most affected by the shrinking, as this is a result of a decrease in working memory. The sensory areas of the brain are less likely to be affected by shrinking. Less functioning of the brain and spinal cord begins in middle adulthood and continues into late adulthood. Physical coordination and cognitive performance are affected as reflexes are hindered. The decline of neurotransmitters is present. For example, the reduction of acetylcholine is linked to memory loss, and severe loss of dopamine is linked to Parkinson's disease and loss of motor control. People in late adulthood will also experience visual decline, which is linked to cognitive decline, as well as engaging in less social and leisure activities as a result. The eyes will not adapt as quickly as before, and the areas of the visual field become smaller. Outcomes of this include cataracts, glaucoma, and macular degeneration. Cataracts involve a thickening of the lens of the eye that causes vision to become cloudy and distorted, which affects approximately 30% of individuals who have a partial loss of vision due to the cataracts. Glaucoma involves damage to the optic nerve because of the pressure created by a buildup of fluid in the eye. Macular degeneration is a disease that involves the deterioration of the macula, which is a part of the retina, which corresponds to the focal center of the visual field. Individuals will have normal peripheral vision relatively, but be unable to see clearly what is right in front of them. Additionally, those in late adulthood will have a decline of depth perception, as well as hearing loss, some loss of smell and taste, changes in touch and pain, possible decreased sensitivity, which sounds like it wouldn't be so bad to not feel pain as much, but it really can be an issue because those who are experiencing this change may not realize that they have an underlying condition that could be really severe and worsen over time. The increase of cardiovascular disorders becomes apparent as lung capacity drops 40% even without the presence of a disease between the ages 20 through 80. Sleep difficulties can become an issue due to other health issues most commonly. Sexually, more direct stimulation is needed. Physically, I think the most important effect is the deterioration of the bones in the vertebrae. This sounds very painful, and losing your height can be very taxing for an individual, both mentally and physically. It's definitely something that I'm not looking forward to, and I hope doesn't happen to me too greatly, as I plan to take care of myself through exercise and a good diet and stress managing techniques. So I really do think that's important to take care of in your earlier adulthood life so that you don't have to experience pain and physical change as greatly as others may be experiencing it. Physically, those who are in the stage of late adulthood will experience wrinkles and age spots. Bone loss in the vertebrae causes both men and women to become shorter. Weight will drop by age 60 due to the loss of muscle. This may give the sagging appearance of wrinkly skin and different body parts that appear to have changed prior to the loss of muscle or dystrophy. Falls are the leading cause of death for those 65 plus, which can be reduced with exercise. This risk is what I meant by reduced with exercise. Falls are largely a result of the lack of mobility one has, so by exercising and taking part in different activities, older adults can have a better chance of not falling. The hippocampus and olfactory bulbs are the only places in the brain that we really see neurogenesis begin. The neurons usually only last a few weeks, and scientists have discovered that drugs, stress, and exercise may be inhibitors that affect the process of neurogenesis in these areas. Dendritic growth can occur up until age 90, which is not exactly certain by scientists, but has been seen in certain experiments. And additionally, lateralization is used in a lot of late adulthood people, as both hemispheres are utilized instead of younger people who utilize either the left or right to complete certain tasks. Lateralization is important for those in late adulthood as the decreased function of both sides needs to be evened out. Cognitively, many of the factors are very important, but if I had to choose just one, I would say that the decline of neurotransmitters is most concerning, as the reduction of acetylcholine results in the loss of memory and as well as dopamine loss, which can be linked to the loss of motor control and in severe cases Parkinson's disease. It's important to take care of your brain because in the terms of plasticity, you either lose it or you use it. And if you want to use it, then that's great. Your brain's going to continue to follow those neurological pathways. But if you don't, you're going to lose those neurological pathways and they are not able to be brought back. Socio-emotionally, older adults may experience hearing and vision loss, as stated before, which can be associated with less time spent out of the home and in leisure activities, a decline in cognitive function, an increase in falls, and loneliness. Individuals in late adulthood who have a partner are usually happier and live longer than those who do not. Around 80% of late adulthooders have living children, which is an important part of one's social network. Friendships expand as social connections are made outside the home. Many older women face the issue of ageism and sexism. And then I included two theories that are common in the socio-emotional perspective of late adulthood, including activity theory, which states that the more active and involved older adults are, the more likely they are to be satisfied with their lives, and the socio-emotional selectivity theory, which states that older adults become more selective about their social networks because they place a high value on emotional satisfaction. Older adults spend more time with familiar individuals with whom they have a rewarding relationship. Older adults may face policy issues, such as those involving healthcare, which can also lead to discrimination. Older adults may also experience stereotyping. Socio-emotionally, I think it's really important to continue to see people and have friends and a supportive network because depression can cause a lot of other health issues and it's also a lot to deal with mentally, and no one wants to spend their late adulthood miserable and lonely. So it's important to make sure that you get out there no matter how much you may not want to, at least sometimes to experience social and leisure activities. Parkinson's disease is a prominent issue for those who are aging during late adulthood. It's a chronic progressive disorder characterized by muscle tremors, slowing of movement, and partial facial paralysis. The disease onset is due to a loss of dopamine producing neurons in the brain. Treatment typically includes drug therapy that will enhance the effects of dopamine, which can be referred to as agonists. L-Dopa is a common drug that is used to treat the disease, which the brain converts into dopamine to make up for what is lost. L-Dopa loses its efficacy over time and is difficult to gauge patient to patient. By this, I meant that doctors have a difficult time gauging just how much L-Dopa needs to be prescribed to each patient to really help them with the effects of the Parkinson's disease and the adversities that come alongside it. So it's a very difficult process that you kind of just have to struggle through to find out what works and what doesn't. DBS is another route for treatment, which stands for deep brain stimulations and involves the implantation of electrodes in the brain. After this, a pacemaker like device is used to direct these stimulations through the electrodes. And then stem cell transplantation and gene therapy are two other hopeful methods of treatment. Physically, as a marker of development, one may be undergoing a lot of pain, as well as dealing with the partial facial paralysis, which can make it more difficult to talk and eat and can result in a loss of independence physically, as one may be wheelchair bound. Additionally, cognitively, one will lose the dopamine that their brain produces, which is a very unfortunate thing as it can cause mental decline as well as cognitive performance becoming lesser and memory loss. Socio-emotionally, one will have to deal with the loss of independence, as stated before, which can be very taxing on somebody who doesn't like help and wants to live on their own because they're going to need a lot of assistance with daily activities that they might not have needed before. Also, their life is going to have to change drastically as they will be on a lot of different drugs and pursuing different therapies to retain the health that they still have. And that can be a lot because you're going to have to miss your social activities and leisurely activities that you used to partake in, and you may not be able to do so anymore. So, this disease causes damage in all realms of development that were discussed prior.